You get that page, that critical lab alert for low calcium, and your mind just starts racing, right? There's this huge list of possible causes. So in this explainer, we're going to take that long, messy list and turn it into a super clear two-path roadmap for diagnosing hypocalcemia. This is all about turning that confusion into confidence. Okay, let's just dive right in. Picture this. The lab calls you and says your patient's calcium is 7.4. Your mind needs to immediately jump to the worst-case scenarios, because that number, it's not just a number, it is an alarm bell ringing loud and clear. And the stakes are just incredibly high. I mean, we're talking about the potential for laryngosms, where the airway closes off, seizures, and even sudden cardiac death. And what's really terrifying, something you absolutely have to remember, is that these disasters can happen without any of the classic warning signs you might expect, like muscle cramps or tingling. So, with that urgency in the back of your mind, how do we move forward without just guessing? We need a system. Let's walk through the absolutely essential first moves you need to make in your initial workup. Here it is, your immediate 4-step action plan. First, confirm it's real. Repeat the lab. Second, correct for albumin. You know the drill. Third, and this is probably the most important part, you have to order PTH, phosphorus, and creatinine at the same time. And step 4, a step you absolutely cannot afford to miss, check the magnesium. We're about to see exactly why that last one is so critical. And this is why we checked that magnesium. This quote gets right to the heart of a major diagnostic trap. See, low magnesium can cause what's called a functional hypoparathyroidism. It basically paralyzes the gland, making it look for all the world like it has failed. But here's the thing, it's completely reversible. If you miss this, you're going to go down the completely wrong diagnostic path. Okay, so now we've arrived at the absolute pivot point of our entire framework. Of all those labs you ordered, the most important one, the game changer, is the parathyroid hormone, or PTH. This one value is the crossroads that's going to split your entire differential diagnosis into two nice, clean paths. Because really, the PTH level boils this whole thing down to one simple, fundamental question. Is the parathyroid gland itself the source of the problem? Is it failing to do its job? Or is the gland working perfectly fine, maybe even working overtime, trying to respond to a problem that's happening somewhere else in the body? Answering that question is the key. And this slide lays out those two paths perfectly. If your PTH comes back low or, weirdly normal when it should be high, the gland itself is failing. That's path number 1. But if the PTH comes back high, the gland is responding correctly. It's screaming for more calcium. The problem is somewhere else. That's path number 2. All right, let's head down path 1, a low PTH. This means the parathyroid gland is the problem. So the question is, what can cause the gland to fail? Well, the list of causes is actually pretty focused. By far, the most common reason is an injury during neck surgery, like a thyroidectomy. So that makes your patient's surgical history an absolutely critical question to ask. Other causes can be things like autoimmune disease, infiltrative disorders, or even radiation damage. And here we are again, back to our great pretender, hypomagnesemia. The literature calls this a reversible functional parathyroid hypofunction. All that means is the gland isn't permanently broken, it's just offline because it can't function without enough magnesium. This is a classic can't-miss diagnosis because the treatment is simple. You correct the magnesium, and often the PTH and calcium will correct themselves. Okay, let's switch gears. We're going back to that crossroads and taking the other path. This time, the PTH level comes back high. What does that tell us? It tells us the glands are working hard, they're doing their job, but they're fighting a losing battle against some other process that's driving the calcium down. Our job is to figure out what that process is. So here are the usual suspects when the PTH is high. Right at the top of the list, you have vitamin D deficiency and chronic kidney disease. Both of those mess with the body's ability to use calcium. We also see this with things that cause a massive release of phosphorus or when calcium gets rapidly pulled into tissues or bone. So how do we tell the difference between the two heavyweights, vitamin D deficiency and CKD? Well, a key lab that helps differentiate them is the serum phosphorus. As you can see here, in vitamin D deficiency, the phosphorus is often low because the body's trying to compensate. But in CKD, the failing kidneys can't get rid of phosphorus, so the level is typically high. That's a huge clue. All right, we've walked through the logic, we've gone down both paths. Now let's pull it all together into a simplified, really powerful blueprint you can use every single time you're faced with this problem. This table right here, this is your high-yield takeaway. It boils everything down to 4 common patterns.
You see low calcium, low PTH, and high phosphorus, you should be thinking primary hypoparathyroidism and asking about neck surgery. You see low calcium, low PTH, but also low magnesium, that's your functional cause. Fix the magnesium first. High PTH with a low phosphorus points you toward vitamin D deficiency, and a high PTH with a high phosphorus, that's the classic signature of chronic kidney disease.
So the real key takeaway is this. By centering your whole approach on that one PTH level, you transform a really complex differential into a simple two-path algorithm. It's a framework that lets you move with confidence and with precision, from that first scary lab value all the way to a clear diagnosis. So now you know how to diagnose hypocalcemia. You have the framework, but getting the diagnosis right, that's only half the battle. The next critical question is how you treat it, because the right treatment depends entirely on the cause we've just figured out how to uncover.